Hello, everyone, and welcome to today's event, Pushing Back on the Digital Spread of COVID-19 Misinformation, sponsored by the National Association of Community Health Centers. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event with my colleague, Alex Walker, the Director of Communications. Before we get started, let's review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this live event is approximately 60 minutes, including introductions, presentations, and Q&A. Again, the duration of this event is 60 minutes, including introductions, presentations, and Q&A. If you do have questions throughout today's event, the chat box is actually located in the lower right-hand side of your computer screen. Simply type your comment, question, or your concern into this box. Make sure you select the To Everyone section. That way we can all see your responses. And as a nice little icebreaker, I like to say, as we get started, just so you can find that chat box, as we plan on having a chatty event today. In the chat box, go ahead and let us know your health center and where you're coming from today, maybe even where you're working from today. Just let us know that you found the box. So if you want to type that information into the chat box, we'd really appreciate that. Friendly reminders that today's event is being recorded. All attendee lines have been muted and will be muted for the duration of this event. Chat box is open. Looking forward from hearing from what health centers you're from and where maybe a city or state that you're also here from. And then if for some reason we cannot answer your questions in the time allotted, we'll make an attempt after the event is completed. At this time, I'm going to turn things over to Alex, who's going to be introducing today's speaker and setting the stage. Alex, the floor is yours.
Thanks, Elizabeth. Hi, everyone. I'm Alex Walker. Actually, I'm the director of digital communications here at NAC. And I want to thank you all for joining us today. This is the first in a series of webinars that we're holding, funded by the CDC, to support health center and health organization communications around COVID-19. I want to just make a plug for our January webinar on January 18th, where we're going to cover in more detail the topic of how to use micro-influencers to promote vaccination. Earlier this year, Surgeon General Vivek Murthy issued the very first advisory of the Biden administration, warning that misinformation about COVID-19 is an urgent public health matter that is putting American lives at risk. And he asked all of us to do our part to limit the spread of misinformation. And indeed, as we at NAC talk to health centers around the country, we hear again and again that COVID misinformation is one of the biggest challenges that you're facing in this pandemic. Patients who are opposed or are undecided about the vaccine frequently cite myths they hear circulating on social media. That's why we're excited to have Dr. Joe Smyser here today. Dr. Smyser is an expert in behavior change communications who tracks anti-vaccine campaigns. And we hope the concepts and best practices that Dr. Smyser shares with you today will help you counter misinformation in your community, not only about COVID-19, but give you some tools that you can use for other public health campaigns that you're working on. So about Dr. Smyser, he's the CEO of the Public Good Projects, a public health nonprofit that specializes in large-scale media monitoring programs, social and behavior change interventions, and cross-sector initiatives. PGP has successfully led one of the nation's largest vaccine hesitancy programs for Black, Latinx, and Asian Pacific Islander communities called Stop Flu. In 2020, Dr. Smyser and PGP created Stronger, which some of you may be familiar with, a national advocacy campaign that works to stop the spread of misinformation using multimedia campaigns, and it reaches millions of people each month through multiple channels and platforms. And with that, I will hand it over to Dr. Smyser to get started. Thanks for joining us today.
Thank you very much for having me. Can you see and hear me okay?
Yes.
Yep, okay, great. Well, I know we only have an hour, so I'm gonna go ahead and jump right in. I'll go and share my slides here.
And I don't know if we mentioned it, but I just want to note that we're going to try to ask you to hold your questions to the end of Dr. Smyser's presentation.
Can you see my title slide okay?
Yes, yes.
Okay. Great. All right. Well, it seems like everything's working. That's definitely not a given. So thank you all again for showing up today. What I've tried to do is put together a presentation that'll give you a little bit of an overview about the general landscape around COVID-19 misinformation, specifically misinformation that has to do with vaccines, COVID-19 vaccines. Then we'll go into a case study of a typical sort of coordinated anti-vaccine attack scenario. It's a real world example. And then we'll go to what you and your organizations may be able to do about your own vaccine communications. And then hopefully you won't be attacked. It's becoming increasingly common. And so I'll give you some tips on what your organization can do as well if you are attacked. Just a quick overview. Alex gave you a great overview, very flattering one on myself and PGP. PGP is a public health nonprofit, so we only work on public health programs. We, in the vaccine space and the vaccine confidence and hesitancy space, we do quite a lot. We were working in the space before the pandemic. Like most of you, that work has accelerated and expanded and evolved a lot over the last couple of years. So we run a number of misinformation monitoring programs. Project Vector is probably our most well-known program. I'll give you a little bit of information from that. We also run, we're UNICEF's partner with vaccine misinformation, so we track vaccine misinformation all over the world, and we help individual UNICEF country offices respond to this misinformation, not just about COVID-19, but about polio vaccines and other vaccines as well. And you can see some of our other collaborations here on the screen. I won't go through each one, but suffice to say, we have a fair amount of experience in this space. We are in a lot of forums with a lot of other experts in misinformation and propaganda and even foreign state actors. And we work with a lot of community-based organizations, hundreds and hundreds of community-based organizations. So I'm going to be sharing with you a little bit about my own views, some views of experts that I work with, and then other organizations that PGP works with. And I'll try and call out whose idea is what as I go, like any good researcher. So the current landscape, and this data comes from Project Vector, which does not represent all of the data that's out there. Project Vector is really a system of systems. So we use a number of systems, and we collect publicly available media data from a whole bunch of different topics, bunch of different social media platforms, newspapers, television, radio, all over the place. It's all sucked into a number of systems, and then we have a team of analysts who go through it, and they're aided by a lot of machine learning and natural language processing because the data is so big.
Dr. Smyser, I'm sorry, I'm going to interrupt. Should the slides be advancing?
Yes, they should.
Okay, we're only seeing the first one.
Oh, interesting. All right, let me go back, and I'm going to try and share just my whole screen.
Yeah, we can see.
Maybe that'll work. All right, entire screen.
Thank you for people in the chat for bringing my attention to that.
Thanks for calling that out. Okay, so how about now?
Yes.
Okay, great.
It's working.
All right, well, you see the logos for what I was just describing with my words. So we'll go ahead, and you all are going to have this PDF, so you can review it at your leisure. But the current landscape, to catch us up to where I was, again, it's a lot of data, and it's a free service. It's for anybody in public health or healthcare, as well as researchers and individuals who work in the media, whose job is informing the public. We vet all users. It's password protected. It's pretty easy to get vetted and approved. Typically, we do that in less than a week. So you can go here and you can log into the system, and you can see it's updated once a week with a lot of context by our team, but then there are also real-time dashboards. So you can look and explore the data on your own anytime that you would like. And it covers the entire United States, US regions according to HHS regions, as well as individual states. So it's a lot of data. So what we found over time is that if you looked at this data, and these are conversations around vaccines, that's what we're primarily interested in with Project Vector. From 2019 to 2020, November, there were about 5,400 conversations a day in the United States that had to deal with vaccines, and in particular, conversations that were opposed to vaccines, so negative conversations. If you fast forward to today, November 2020 to November 2021, so pretty recent, it frequently goes past 24,000 conversations a day that demonstrate vaccine opposition to vaccines. This is not global data. This is just within the boundaries of the United States. So it is a night and day difference between before the pandemic and now. And we use the phrase, it's the new normal all the time. But this is our new normal. It's not going away. It's going to be with us for the rest of our careers in public health. And so it's just something we're going to have to learn to adapt to, which of course is why we're all here today. Exponential increases. That light blue line, the greenish line that you see in the graph there, what we've also found is if you look at anti-vaccine rhetoric and coordinated assaults and campaigns prior to the pandemic, they were mostly organized around personalities. There were a few famous anti-vaxxers that are still around, and they were trying to perpetuate myths like mercury and vaccines and the non-existent link between autism and vaccines and things like that. Well, those are very quaint, very out of touch talking points now. Now, most of the anti-vaccine movement, which is a globally coordinated, much better organized, much better funded movement than it used to be, organizes around real-world events. So, so you can see here real-world events when certain vaccines were approved for emergency use authorization, when the FDA approved Pfizer's vaccine, when there was a federal vaccine mandate. Now, and this is national data. The same is true if you look at a particular state or if you look at a particular city. They are looking for real world events, and then that is what is being used to mobilize many, many thousands of people against public health and against vaccines in general. So it's, again, just very, very different than it was prior to the pandemic. So what are we looking at just this month alone? Everything's being driven by kids. So the changes in recommendations and mandates around vaccines with children, COVID-19 vaccines and kids, this is not news to any of you, but I don't know, maybe it'll be cathartic to see that it's also reflected in the data. Everything anti-vax at the moment, and this will change next month to something else, is around trying to terrify parents not to get their children vaccinated. So we're seeing disinformation around changes in vaccine formulations, which isn't true. And we're seeing a lot of pushing of different unapproved treatments and cures for COVID-19 so that people can avoid getting vaccinated. And these are organized on listservs and blogs and video channels and in-person summits. Again, we're talking about a really, really well coordinated political movement and social movement, not a fringe group of individuals anymore. So the best way to spread misinformation is to say it over and over again. No matter how smart you are, no matter how educated you are on the subject, what research has found again and again and again is that if I tell you the same thing over and over and over again, eventually I will erode your confidence and patience, and you will be far more likely to believe what I'm telling you, even if when I started, you knew what I was saying wasn't true. So this is a tactic that's employed all day, every day by anti-vaxxers all over the world. Terms to know, you all know the definition of information. You all know the definition of rumor. What's new in healthcare and public health are the last two: misinformation and disinformation. So misinformation is just things that aren't true. Disinformation is engineered falsehoods. So the person who's creating this information that is not true knows it isn't true and is doing it for their own purposes. The difference would be if a relative posts on Facebook something that you know not to be true, that is probably not an attempt to cause intentional harm. It just might be a misunderstanding. Versus a fake news website, for example, that is trying to get money by incentivizing you to click on a link for a fake news story. They're trying to get money from ads. So those are two really different motivations, but of course we live at the intersection of all of this, and it all adds up to one really confusing mess called an infodemic. So infodemiology is a brand new field in public health. It's popping up all over the place. The World Health Organization was the first one to use the term widely in March 2020, which feels like a lifetime ago. But now you have universities all over the United States popping up credential programs and certification programs and full courses on infodemics and infodemic managers. And some of the people and organizations that have emerged during the last 2 years as really leaders in the space, people who really know what they're talking about, that I would encourage all of you to pay attention to and follow would be these organizations on the right. There are many, many more. These are just organizations that I myself hold in high regard, and they're producing some of the best research that's out there on really what to do about it, what's the state of it, some really good stuff. Speaking of the current state, so we all know we live in two realities right now. There's reality A and reality B. We know that Republicans are not getting vaccinated anywhere near the rates as Democrats. That's not a mystery as to why. It depends on where you get your information. If you follow Fox News versus MSNBC, you live in a dramatically different reality than the person who follows the other news account. And unfortunately, for all of us who work in public health and healthcare, we're wedged right in the middle of that nonsense, and we are the ones who have to answer people's questions and inform people in the maelstrom of nonsense. So if you look at motivators behind, why is this nonsense happening? I alluded a little bit to it before, but really, if you just peel back the layers, it's pretty simple. It's profit, politics, or power. The crocodile tears shed by anti-vaxxers and anti-science and anti-government and every other element of nonsense that's out there at the moment, though there are people who really are trying to help, they are the minority. And I'm hearing a little bit of feedback. If somebody could mute their mic. Thanks. Really what's driving this mostly is an attempt for impact, an attempt for influence, an attempt for money, which is no surprise because human beings are behind it. And these three things motivate most of what human beings do together. So if you look for tactics, cherry picking data, so a study comes out, they'll share one line of a study and include no context. Many fake experts, so either physicians that have completely lost their minds or organizations that have fancy sounding names but have no actual credibility. The list goes on. A lot of race baiting has occurred during the pandemic, so a lot of targeting of minority groups, Black communities, Hispanic communities, Asian Pacific Islander communities, Native American communities, the LGBT community. You take your pick of individuals who have really good historical reasons for distrust in health systems and public health, really legitimate concerns based on historical precedent. Anti-vaxxers and their associated organizations know this and are going to Black Lives Matter marches and merging with these groups and arguing, why would you trust public health and healthcare when look at what they've done to you in the past? Why would you trust them on this issue, on the issue of vaccines? And it's working, it's a really concerted effort. And then of course values baiting, and that goes into the politics of the whole thing. Do you value freedom? Well, then why would you get vaccinated? On the face of it, it makes absolutely no sense why you would put those two things together. But of course, in reality, it's winning over huge swaths of our population. Recurring themes, you can see them there. I won't read through each one, but if you look through these conversations that are occurring all over the place, these are things that come up again and again in terms of framing devices. And then you look at really who's behind it. So again, in the 90s, the 2000s, the early 2000s, right before the pandemic, traditional anti-vaxxers. Now you've got conspiracy theorists, you got opportunists, a lot of white supremacists jumping on the bandwagon, a lot of militias. You do have foreign actors. They are less important than our own homegrown organic people. And then you have our own politicians, which is a new thing. There was more anti-vaccine legislation proposed in the United States this last legislative cycle than ever before in the history of the United States. This will continue, and it is now, the platform of many people who are running for local and national politics. So those of us who care about vaccines have a lot of work to do. It's good job security, I guess. If you look at sort of how we're doing versus compared to how the other side's doing, this is a study that came out in Nature, which is probably the most, the highest impact factor health journal that exists. It looks complicated if you're not familiar with social network analysis, but in a nutshell, what you're looking at is, and some of you might be familiar with this study, pro-vaccination groups on Facebook talk to themselves, talk in an echo chamber. The people who follow those accounts already believe in the importance of vaccines and follow each other. And anti-vaccination individuals on Facebook and groups appear where you live your life. So they are the member of your running group, they are a member of your parenting group or your cooking group, and they will just subtly start talking about their concerns about vaccines, and they'll find you where you are rather than a public health's traditional approach, which is please follow the page of my community health center, please follow your local health department, please follow your local vaccine coalition, and we desperately hope that they'll follow us and pay attention to us. The other side has a very, very different approach. Again, they go to where the people are, and they frame their arguments. If you're in a running group, all your arguments that you'll start seeing are about running against vaccines. Everything is linked to the outcome that matters. So it's a really, really different approach. And what these researchers did was they looked at the scale of it globally and what is likely to occur. They modeled it out, and the model doesn't look great for those of us in public health. What the model essentially says is, if things continue as they are, you will find many, many more. The anti-vaccine narrative will be much more common than the pro-vaccine narrative. And we are living through the results of this. This was 2020. We are already seeing this pop up all over the place. So, case study. Some of you might be familiar with the organization Shots Heard. It's Kids Plus Pediatrics is a very large pediatric practice based in Pittsburgh in the United States. They released what under normal circumstances would be a pretty tame HPV vaccine public service announcement. And they really were just intending to reach, parents of the kids who go, who are treated at their own clinic. They released it Wednesday, August 23rd on 2017. They got 15,000 views and they were applauding themselves. They thought they did a great job. Well, fast forward a little bit less than a month, and that HPV vaccine public service announcement had been viewed over 100,000 times. Well, you're probably asking yourself, all right, what's the bad news? Well, the bad news was those views were because of anti-vaxxers. So their PSA got posted in the usual places anti-vaxxers talk to each other. And what happened was every account that Kids Plus managed, their Facebook account, their Google account, their Yelp account, their Twitter account, their website, every single public-facing piece of it was swarmed with a globally coordinated anti-vax attack. So they brought their Facebook business ranking down to less than 1 star. Same thing with Yelp and same thing with Google. Over the course of a number of extremely stressful days, they ultimately had to ban 791 people on their pages. And this took a team of volunteers working 7 days a week in all the free time that they had. Now, at the time, this was regarded as a pretty extreme example of what anti-vaxxers could do if they united for a single purpose. Now, this, of course, is just normal. This is what we see multiple times a day. So it took 344 days to get control of all their accounts again and get their reputation, their online reputation, back to something that would look like normal, like it was prior to the attack. So just a tremendously horrible experience for these pediatricians. But they learned a lot by going through this. So what they learned was disinformation campaigns rely on sensationalism. They rely on lots of people coordinating to attack you, and they rely on posting things about you in a lot of different places to mobilize an online army against you. So they will amplify the same talking points over and over and over again. And their goal is to harass, threaten, and harm. So these days, pretty much anybody who's talking about vaccines in a good way anywhere is pretty much guaranteed to be attacked. And you're lucky if you haven't been on the receiving end of a large coordinated attack, but it's going to happen. So now we just need to plan for it. And luckily, there are ways to plan for it. We can learn from the people who've gone through these horrible experiences. And part of it is just knowing what's going to come. So knowing that these are the goals. They need to harass you. They need to threaten you. They need to make you feel like you are going to be harmed. So it's horrible. They knew they weren't going to be the last victim, that this was a tactic that was going to be deployed again and again. They knew they needed better resources. They were looking around. They started talking to other healthcare providers. They were seeing that this was common. And so they launched a 4-pronged counter response. And that involved doing their research, creating a toolkit, organizing a bunch of volunteers, and again, just heightened vigilance. And this is sort of what came out. This is what was put in the toolkit that exists today. These are what you can expect. You can expect rapid waves of individuals trying to dox you, trying to vote your business down, your clinic down, trying to post everywhere that they can, including on your personal accounts. It'll be organized. They'll threaten everything under the sun. They will make up threats. They'll say you're violating HIPAA, that just choose anything that might aggravate you or damage your reputation. It'll be used. Lots of abusive words to try and frighten you. They are anonymous and you are not. So there is a high degree of terror, of terrorizing that goes through this. And really they want you to never be able to work again. So they're going after reputational harm. They're really trying to damage you. So knowing that that's their goal, what we try and do, and what other organizations increasingly are trying to do, is in the process of this, turn what they're trying to do into things that work to our advantage. So where they try and overwhelm, we connect and unite. We reinforce and strengthen. We reassure and empower. We protect and defend. We repair and recover. We embolden and we galvanize. And what came out of that was this program called Shots Heard Around the World, which is a program by physicians for physicians. So there are now well over 1,000 physicians active in a private group, that when one of them is attacked anywhere, when a healthcare provider is attacked anywhere, you do not need to be a member of Shots Heard. People will come to your aid and help you get through the experience. And I wish I could say that this was less needed now than before, but it's more needed now than ever before. What they learned was if you make it through, you're bulletproof. If you can make it through the horrible experience of being attacked by a coordinated anti-vaccine attack, you are untouchable. They're not going to mess with you because anti-vaxxers are bullies. They're going after soft targets, and there are more than enough public health organizations and healthcare organizations that have no plan and are completely ill-equipped for 1,500 anti-vaxxers posting simultaneously day after day after day after day. If you are not one of those soft targets, they're going to go to an easier target. So these are the two gentlemen who run the pediatric clinic and who created Shots Heard, and their success story is very inspiring to a lot of us who work in public health, and they just were on the cover of People magazine just recently. So what does it mean? What can you do? You need to have your reinforcements ready. There are some examples you can pull from that are more recent than Kids Plus. There are many state vaccine coalitions, for example, that are under constant attack here in the US. What they do is they don't have enough people to block, ban, and delete all of the individuals who harass them all day. And so they have actually partnered with Australian vaccine coalitions because they are on the other side of the world. And during the nighttime, the Australians log in, they have admin credentials to the state vaccine coalition here in the United States, and they block, ban, and delete for their friend. And then the Americans do the same thing for their Australian friends during their nighttime. That's where we are right now. That's how bad things are at the moment. It's not a sustainable solution, but it is a solution. And the silver lining is the anti-vaccine movement is global, and public health, up until really this pandemic, wasn't. Global health was an entirely separate discipline within public health. It's not so much the case anymore. What we're seeing is partly driven by us all having to work online much more. You can make friends and influence people all over the place. You don't have to worry about the boundaries of the United States so much anymore. So there are a lot of allies, and we are learning as we go. But there are many people who are fans of vaccines, many more people than who are not. So friends are out there. Prepare yourself. Do you know all your account logins? Do you know who has all your account logins? Do you know all the places where someone can find you? Have you ever Googled yourself? Have you looked at how easy it is to find your friends and family members if someone knows your name? Figure out what can someone find out about you and your place of work? How easy is that? And what can you do to make accounts private, to protect yourself, to make sure someone can't just go and post anything they want in every place where you appear? There are steps that you can take. Prepare your workplace, office, or institution. So if you're running vaccination campaigns, prepare your boss and prepare the people who are in charge of external communications to know that you are going to be attacked. They need to be aware, so that their first reaction when it happens isn't to circle the wagons and not talk about vaccines anymore. And I could tell you from personal experience, there are very large hospital systems right now who won't even post seasonal flu information because they're so petrified of anti-vaxxers coming and swarming their accounts. They're worried about their business reputation. So this isn't something we have figured out yet as a field. Again, just monitor your account security, use things like password protected sites and password generators. Don't have your password be password. Know your platform settings. And again, yeah, just Google yourself. Be aware of what they're going to be aware of. I speak from personal experience. I've been on the receiving end of horrible anti-vaccine attacks. They've attacked my parents. They've attacked my siblings. They've gone to their employers. It gets really nasty really fast. And there are some things that you can do to make it a lot easier to weather that kind of stuff. Defend yourself. So 10 actions you can take immediately. The main one is just remember that it's important to keep track of everything, to document what goes on, but you don't immediately need to disappear off the face of the earth when you're attacked. There are some things that you can do that mitigate the ability of people to ruin your life. And if you weather the storm and you come out the other end, again, you will be better for it. But there are some really important things to do. Like, for example, keeping track of all the comments made. So blocking, banning, and deleting is really important. That needs to happen after the screenshots happen. You need evidence. If you delete all the evidence, nobody can help you. And there are things like that that are really, really important. There's a series of steps to take. And there are free tools that you can use that will go through and automatically scrape all your social media accounts and document everything for you. They take screenshots every few seconds. Government social media accounts have to do this because of sunshine laws, but most clinics and public health organizations are unfamiliar with these tools. You can report and block and ban. Engaging with attackers is usually a huge mistake. So if somebody just wants to have an honest conversation, go for it. If somebody's showing up to pick a fight, you owe them absolutely nothing. So block, ban, and delete them. Don't waste your time. And again, just you can see that I won't go through all these steps here. You have these slides, but again, it is a little bit different of a universe than it used to be. And then move forward after an attack, and that means a lot of things. But the first thing is taking care of yourself. These are really stressful to go through. You start to doubt whether you did the right thing. You start to wonder, is it even worth it? Speaking from experience, you turn off all the notifications on your phone, which makes it really hard to get your Uber Eats orders. There are things you can do to make it through, and again, you will achieve nirvana on the other end. So again, it's all about preparation. Measure twice, cut once. So what you can do with messaging, and I'm moving along at a fairly quick pace, I know, but what I'm trying to do is get through all these slides so we can have a good conversation at the end of it. What people in public health and healthcare are learning is what other fields have learned already. So this was not, it was a very small minority of researchers really in public health who were at all concerned with misinformation prior to the pandemic. That's now ballooned up. Just about everybody is concerned with it. What that means is you can look to areas like political science, computer science, climate change. There are researchers and studies and campaigns and effective methodologies and tactics and strategies that have come from these other fields. Public relations is probably the field I would recommend the highest. Crisis communications from public relations is 99% relevant to those of us in public health who are trying to deal with vaccine communications. Because it's about deciding what your talking points are, weathering storms, being clear, all of these really essential elements of communication that don't require you to know about vaccines because they're applicable to any topic. How do you protect somebody's reputation? How do you protect the reputation of an organization? PR people know how to do this stuff really, really well. It's not something that public health people are trained how to do. I speak as a public health person. So here's one study that is a good one. There are a lot these days. So there's kind of three main response scenarios if you're trying to respond to misinformation. One's debunking, which probably most of you are already familiar with. That's where you respond to the information when you see it. There's inoculation theory, or inoculate, sometimes called pre-bunking, which is the term I prefer because it sounds less wonky. And that means preparing people for what you know they are about to see so that when they see it, it does not affect them. It's taken straight from how immunization works. And then reporting, which is using the tools that platforms provide you to report, block, and ban accounts and individuals that you see. And I'll give you a couple examples of each one of these. So debunking, this is taken from one of our campaigns called Stronger. But this is an example of debunking because this is in these posts that we posted on social media accounts, we're telling you about the misinformation and we're debunking that misinformation while we're informing you about it. So we're saying a man claiming to be a CNA, blah, 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 and then here's the reality. Beware of a fake CDC document that says this, blah, 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 here's the reality. So that's what debunking looks like. Most people at the moment in public health and healthcare are a little uncomfortable with debunking because you really have to have a fact-checking team and you really have to be good at putting something together, putting a communications together that isn't going to make the situation worse. There used to be a pretty hardcore theory in public health and healthcare that you could not address misinformation at all because any attempt to address it would by default make the situation worse. And everybody cited one guy's paper that was true. That guy has since come out and said, you guys were all misreading my paper. So it's just another example of we're learning as we're going. It's okay to fight back. And if you remember one thing, just remember that. We don't have to be quiet anymore. If you're as old as I am, you remember all of your advisors and your trainers telling you that you weren't allowed to engage with the public unless under very strict circumstances. That is no longer true. That's no longer our reality. Please speak up. Here's another example. This is just a true example, but you can see here, it depends on your comfort with the situation. So this is a comment, an untrue comment made on an organization's Facebook page, and then you can see someone's real response to it. You can respond privately. You don't need to respond publicly. You can report the account under, if you can see it's really disinformation of this person just being a bully, or you can decide to do nothing. It's all up to you. My advice overall is don't demonize the poster. And I'll say that again and again and again. And all I mean by that is remember your dignity. You are a representative for science and for public health and healthcare in any role that you have, and you will have people spit in your face because you've chosen this profession. they have left their dignity at the door when they decide to attempt to debase you and your profession. You can't get in the mud with them, as tempting as it's going to be. But just make sure at the end of the day, no matter what you do, your dignity's intact. It's not worth it to become as nasty as the people you're fighting. And there are a few instances in public health of people where I've seen they've gotten as dirty as the people that they're fighting, and you can tell you are the people you spend time with. So just make sure that you continue to be surrounded by good people, because this is hard work. To target, so here's an observational correction. I'm going to continue to move forward here, but what I tried to do was just give you a few examples of debunking as we go. There's ways to respond to memes, even just popping a link in there. You don't need to figure out like the right, convincing narrative. Sometimes just putting in a fact check link can be really helpful. And what we also try and remind people too is we're not making any assumption you're going to change the mind of the person who posted the thing. What you're doing is, though, you're putting something up for every other person who's going to see the dialogue that you're engaging in. You're probably not going to change the person's mind, but you might affect the 500 people who see how you responded to the person. And that's really, really important. You're leading by example. Inoculation theory, it's a fact sandwich, really. So there's a wrong way and a right way to do it. And the right way is lead with the fact, then talk about, explain misinformation's coming up, explain why it's misinformation, and then end with the fact. So this doesn't come from PGP, it comes from researchers in the field. This is currently regarded as best practice. So if you're going to try to inform people of something that's coming up, the best way to do it is a fact sandwich. Fact, warning, fallacy, fact. So an example would be, if you see posts claiming the government's own data shows vaccines are causing death or disability, that's misinformation. This is why we can't have nice things. It's a simple example of an inoculation message. There's another example of an inoculation message. Whether or not you are personally a fan of this politician, that t-shirt counts as an inoculation message. Vaccines cause adults. You can also, there's a lot of research on this, and I'm very happy to send links and some other materials to anybody who's interested. It takes time to get good at it. So don't expect straight out of the gate you're going to know how to do this and feel really comfortable with it. Like anything else, this is a field of study, and it's going to take you a few rounds to get to a point where you can do it without thinking. And that's totally okay and totally normal. Reporting, every social media site that is popular, that you would be spending time on as a professional, has a way to report accounts. So, and what the social media sites themselves say, who have a huge amount of culpability in causing the situation that we're all living through. But they do point out that though they are frequently held to task by those of us in public health, when they ask those of us in public health if we know how to report misinformation when we see it, almost none of us do. So I do think it's important that we meet halfway. And if we are going to say again and again that Facebook or TikTok or Twitter or whatever have ownership over this problem, it is our responsibility to understand the tools that they have given us. We don't take any money from the social media companies. I am not a paid spokesperson for TikTok. And then just some examples of what you can see and how you can, just some tactics used. You're probably all kind of familiar with these, but so do's and don'ts, I'm coming up on the end here. Just remember, again, keep your dignity, be personal, show empathy, validate concerns. You have vastly more on your side than the other side does. They have to manufacture reality. You can just live in it. They have, and there are very different experiences for why somebody might be saying a thing. And so try and tease out if this is an honest conversation someone's trying to have. Is it an honest question? Do they maybe have a really good reason to be worried about vaccines? What's their background? Try and give them the benefit of the doubt and engage with them just as a professional. And again, don't get political, which is almost impossible these days, but because the other side's actively getting political. But try to not be Try not to repeat misinformation. Try not to take it personally, which is really hard when the other side's entire tactic is to make it personal. Try not to vilify the share, and try not to rely on fear. So again, fact sandwich, some great resources here. You all have the slides. I won't read through each one. And that brings us to the end. So thank you. Thank you very much for your time.
Thank you, Dr. Smyser. There's your riveting presentation started a whole chat while you were speaking. So,
well, I couldn't see it, so sorry.
No. It's fine. It's just evidence of how engaged people are in what you're discussing. I wanted to start with a couple of questions that we got in advance, and then we'll turn to some of the questions that came up in the chat and comments. One of the first questions we got in advance was about the levels of mistrust in Black and Brown communities based on history and structural racism. How can misinformation be addressed in Black and Brown communities where distrust is very high due to a history of mistreatment, and I'd say current reality of mistreatment by medical institutions?
Yeah, you definitely have to. You don't have to go to yesterday to find examples of mistreatment, and structural racism is real and exists as we're speaking. Yeah, what I turn to myself and what we advise other organizations to do is don't presume that you are the best spokesperson or that the answer lies in you or your organization. One of the amazing things that we've seen during this pandemic is community organizations and community leaders have stepped up in Herculean ways, often in the absence of any real leadership from the public health community, certainly in the beginning of the pandemic, and just figured it out. Got people the information they needed, knocked on doors, worked really hard to get people immunized, people that never worked with their health department before. And I really hope that doesn't go away. And I hope those of us in public health remember really what the core of public health is community health. And that is not true just of epidemiology. It's supposed to be true of health communications. Shoe leather epidemiology should also translate to shoe leather health communications, which means that it is not the job of a local health department or a local hospital system or a local clinic to have all the answers. It's our job to provide people the information and let those people be empowered to be spokespeople for public health. And that's become really, really clear during this whole experience. So I would say in communities that have high distrust or historical high distrust or low confidence in vaccines, I don't have the answer. My job is to talk to community leaders from that community, figure out what the issues are, give them the information that I have, and then get out of their way. So that's my personal view on it. And it's not hard to find amazing, again, there are just amazing rock stars and heroes in every single city in this country right now that are doing amazing work. They should just be empowered.
We've certainly seen that among community health centers. So getting to something a little bit more narrowly focused, but this might be an opportunity for you to mention your collaboration with the Public Health Comms Collaborative on misinformation. The question is, should we respond to misinformation posted in comments? For example, if someone recommends ivermectin on a vaccine post, is there a list of suggested responses?
There are organizations that do curate sample responses. And so I could pull those together and send those to you all. Generally, I do think it's important to respond, and I know what that takes, so I'm not saying it lightly. But if you do the work of, most questions and comments tend to be pretty predictable, because though there are a smaller number of accounts that create misinformation, the talking points that anti-vaxxers use or that sow confusion, they of course go everywhere. So you start hearing the same things over and over again, and people don't know where they first heard it, but nevertheless, they have questions about it. So I think it's important to respond to stuff, but again, respond to stuff, and then if it turns into just a nightmare scenario where this person's just actually like they laid a spiked pit and they were hoping you fell into it, then just ban them. It's you don't owe anybody anything. If they're not trying to work with you, they're not just being honest, and they don't have an honest question, my vote every time is get rid of them. It's not worth it. And it's very satisfying to do that.
All right, I put in the chat the link to the misinformation alerts that are on the Public Health Collaborative, Communications Collaborative website that I know your organization helps update.
Mm-hmm.
Right.
Yeah, I will say too, you should feel better about banning, blocking, and deleting if you have community guidelines up. So you do need it to always provide a link on any social media accounts that you have to your community guidelines.
Good point. And
then that protects you. You know, the second somebody cusses at you or spreads disinformation or anything else, you have a reason to do what you need to do. It doesn't seem so arbitrary.
Okay, we keep hearing, this is a big one, we keep hearing that those opposed to the vaccine cannot be convinced with facts. What, if anything, will work?
I mean, you're not, probably a lot of you are going to be unhappy with this answer, but we are at this moment where I do think people need to hear from people who are like them, and because of the echo chambers that none of us created, but we now exist in. All we're doing is acknowledging the reality that was forced on us. We are a really polarized, divided country, and it's a lot to ask for public health to figure out a way to convince people who are hearing from us, maybe if we're lucky, one time a week, but they're hearing from megaphones 24/7 that are telling them not to listen to us. So that's a really complicated scenario that is really unfamiliar. It goes back to McCarthyism. We live in a really complicated time. And the only thing I think we can do is try and cross the aisle as much as we can and try and find allies in communities that are communities that have low vaccine confidence. Try and find somebody who looks and talks and has similar worldviews and similar lived experiences as the community you're trying to reach. And that person needs to be empowered. It's an entirely different way of doing public health and vaccine communications, but I can't see any other way through it personally.
And yes, I think that's something that a lot of our health centers are definitely, those partnerships have been key this year. A question for...
Sorry, just one thought. What we have been advising people to do is stop linking just to the CDC's website. It's important to link to the CDC's website, but public health has really, really low trust at the moment, really widely disregarded. The de Beaumont Foundation just recently did a survey. I mean, we are not beloved across a whole bunch of industries because we are associated with the bad parts of the pandemic. This is not news to any of you. So link to community organizations who are in your community, link to trade associations, professional associations, link to business pages. There's all these organizations that have put up information about vaccines that are very pro-vaccine. They've curated resources. There are lots of organizations that represent different racial and ethnic groups. Link to those groups, those pages, those resources of those groups. Don't just provide the same CDC, Q&A website. It's just not doing it anymore. There's a lot more to draw from than before. So just make your resource lists longer and more tailored. I think that will help a lot.
That's a really good point. I've been hearing that too. A question from Anastasia from Massachusetts. She says, thanks for this fascinating presentation. She has 3 questions, but I'll start just with the first one. Are you identifying positive vaccine conversations as part of Vector, I think, or do they not exist? If so, what is the % of positive versus negative conversations?
They definitely exist. We do, and we certainly focus on the negative because that's what we're trying to track to share that data. They're not as common as the anti-vaccine. So it's just like most things in public health. If you go and you try and do some media monitoring, there's not a ton of people other than public health people who are out there talking about the benefits of vaccine just for fun. Usually it's a campaign or where there's a reason we're doing it. There's not that's not so much the case as much as it used to be, but it is We really need, there isn't a huge mobilized movement of people in any country that are just out there extolling the benefits of vaccination. They are out there, they do exist. There needs to be more of it. And there does need to be a lot more work on identifying good sources of health information, because so many organizations are focused on bad sources of health information. So that's work that needs to be done. We do a little bit of it. But yeah, it's pretty uncommon, to be frank, looking for just your average everyday person who's out there talking about how much they love vaccines. It's pretty cool.
Yes, we're getting Jonathan, Alaska. We're going to have to hear more at a different point from you about all. It sounds like you're doing some great work following Dr. Smyser's guidelines in Alaska. We'll have to hear more about that. I guess the last question I'm seeing here is, who is funding and organizing the anti-vaccine movement? And if that's not something that you can answer in 2 minutes, then we'll end.
We don't do it, but there are organizations who do track that stuff, like the Center for Countering Digital Hate, CCDH. There are other organizations too. Really, profit and influence used to be the dominant reason, and now it's political power. So they are really, really well organized. There are bus tours, and there's a new documentary every 15 minutes from the anti-vax community. It's a global network. There's a whole production studio in Malaysia that just churns out memes. These are multi-million dollar industries. And the trickle down is to your relative on Facebook who just parrots the talking points, but the mechanism behind it is global and highly coordinated. They all know each other. They're all in the same email newsletters. They all go to the same conferences. They continue to go to in-person conferences during the entire pandemic when those of us in public health stopped. So it's a well-oiled machine, and it's growing. It's not getting smaller. It's exponentially larger than it was 2 years ago. And they are finding a lot of willing ears and eyes all over the world. Unfortunately, one of the United States' main exports at the moment is disinformation.
So I'm sorry to stop you there, but I will. I just want to. We've got less than a minute left, and while that's really overwhelming, I want to focus on how us having this conversation right now and getting your insights helps to galvanize us to push back. And as many have observed, there are more of us than there are of them.
Yeah.
We just have to speak up. We have to report. We have to engage. And I think that's one of the takeaways from your presentation is we need to engage. Don't let the falsehood pass you by. Report it. Right.
Yeah, we have something that they will never have, which is several things. The first is truth. The second is training. And the third is community relationships. We know our communities in healthcare and public health. We know exactly the makeup of our communities because we serve them. It's the best job in the world. So we know who to go to create allies, and we can build these networks to help each other out. Everything that they rely on is a mountain of lies and falsehoods for self-serving purposes. That is the antithesis of public health and healthcare.
And then
we've got right on our side.
That's right. And we've got the relationships and the trust. Well, thank you so much for your time and expertise, and everybody in the chat. Some wonderful insights and resources shared. We will package it all up and send it to you. So just watch your email, and we will definitely keep talking about this in different platforms. Thanks, everyone. Have a good afternoon. Bye. Bye, Dr. Smyser.